There's been a lot of interest recently about our gut health, or more specifically, the balance between the unhealthy and healthy bacteria, or in other words, the microbiome. It is now well established that if you have poor gut health, you're more likely to have bloating, indigestion, you're going to feel tired, not sleep very well, be demotivated, have a low mood. In the long term, poor gut health is linked to an increased risk of viral infections such as COVID, chronic degenerative diseases such as arthritis, dementia, an increased risk of diabetes and heart attacks. It is also linked with an increased risk of cancer of the gut, but also cancer elsewhere in the body, including prostate cancer. There are several mechanisms of why poor gut health is linked to an increased risk of cancer. First of all, you need a healthy gut to break down healthy components in foods called phytochemicals. The phytochemicals give food its color, its smell, and its aroma, and they have enormous health benefits. They reduce inflammation in the body, they improve antioxidant pathways which protect our DNA, and they help increase our immune surveillance. There's also evidence that men with prostate cancer who have poor gut health are more likely to progress faster. What has not been established is that if you improve the health of the gut in men with established prostate cancer, that would actually slow the rate of progression. And for some men, that would mean they don't have to go on to have radiotherapy or surgery or hormone treatments, all of which have quite considerable toxicities which will affect their daily quality of life. For these reasons, it was decided in our research centre to work with patients to design a robust prospective trial to see if we can improve diet and strategies to improve gut health, and evaluate whether that could slow the rate of prostate cancer progression and at the same time improve other symptoms related to the prostate, such as the waterworks and erectile function. So the first thing we did is work with 3 patient support groups involving over 300 men with prostate cancer to see what was acceptable to them. This proved really useful because men were able to help us with the design of the study to ensure when we asked people to go into it, it was acceptable to them. This resulted in over 230 men being recruited in less than 6 months, and it became the fastest recruiting study in the UK thanks to the patient involvement. There are several important lifestyle and nutritional factors which help us maintain or even improve our gut health, and these include reducing processed sugar, sweeteners, stopping smoking, not drinking too much, exercising regularly. But above all, the 2 most important factors are increasing foods which contain natural healthy probiotic bacteria and increasing the intake of phytochemical-rich foods. Phytochemicals are natural substances which give food its colour, taste and aroma, and on top of these wonderful properties they have enormous health benefits. We know from clinical studies that populations who have a higher intake of phytochemicals have a lower risk of cancer, including prostate cancer and many other chronic diseases. 14 years ago we conducted a trial which boosted the intake of phytochemicals using a capsule which contained turmeric, green tea, pomegranate and broccoli, and we showed it slowed prostate cancer progression. Since then there's been further evidence for other foods such as cranberry and ginger on the benefits for prostate cancer, but also prostate symptoms. For this latest study involving men with established prostate cancer, the scientific committee felt it was imperative to include these 2 new ingredients which have also shown a benefit. For clinical trials, it's important to control and boost the intake of probiotic bacteria using a capsule. This particular capsule was developed specifically for our studies as it contains a good quantity of 5 lactobacillus probiotics combined with a good quantity of a prebiotic inulin and vitamin D within a slow-release capsule. So in other words, it was picked because it has a track record of being effective and safe. Blood tests were taken before and after the intervention to ensure the supplements had no adverse effect on the body, but more specifically to measure a protein called prostate-specific antigen, which is a marker of the volume of disease within the body. You can see in this particular case, since the intervention, the PSA went down, which is actually a surrogate marker of a response to the supplements, as in this man. Patients were asked to fill out questionnaires about their urinary symptoms, such as how often they get up at night and their quality of their erections. For strength, we used a grip strength monitor. Now, grip strength is actually an interesting endpoint in this trial because it does correlate with overall well-being. To assess tumour size, men underwent an MRI scan before and after the intervention. In that way, we were able to measure the actual lesion and see if there was any progression, regression, or stabilization. In that way, we can ensure that the PSA changes actually correlated with underlying disease. Now the trial has finished, the data has been collected by the independent auditors and sent to the statistician. We will know the final results of the trial when it's presented in the world's largest urological conference called ASCO Urology in January in California. There was an interim analysis presented in the British Society of Lifestyle Medicine conference, which did already show some significant slowing of the PSA, improvement of waterworks and erectile function. Certainly a lot of the men who were on the older supplement who changed to this new one had a further reduction in their PSA, which is very reassuring. In the meantime, this trial has clearly shown that it's appropriate for men with prostate cancer to increase their intake of healthy phytochemical-rich foods. It would also be very sensible to adopt strategies to improve their gut health.